Sometimes babies are born and the pediatrician notices the kid didn't make a bowel movement. He looks at the rectum, puts his finger up there, it doesn't pass, and tells the parents we got a little bit of a problem. What is that problem called?
You can't do a rectal exam. It sounds like there's a little stenosis, a little narrowing.
Narrowing in a perforated anus.
Yeah.
How would you, as a surgeon, want to approach the problem, and how can we get the situation so the kid can function down the road?
Well, if the baby is not able to pass any air or stool at all, it's an emergency because the bowels would get very swollen, the baby would be vomiting, and couldn't get any nutrition. So that needs some sort of emergency procedure. That baby needs to be in the hands of a team with pediatric anesthesiologists, and pathologists, an NICU, and a surgeon. As often as not, the first operation that baby would get would be to bring the bowels out to an appliance called a stoma.
In other words, give a way to get some of that buildup of stool outside.
Yeah, it's a wonderful method to relieve the obstruction. It doesn't bother the baby a bit. It gets the parents a little upset that the baby's not stooling into a diaper, but it relieves the obstruction, allows them to be fed.
A fix in stages, correct?
And if a baby can't pass any stool at all, that would usually be the case, yeah.
Okay, so the first approach, as you said, a way of getting some of it out. So that's a little hole, bring the stool outside, and they put a bag on and they collect the stool externally that way.
Yes, sir.
Okay, but down the road, what is your approach going to be?
Well, with the availability of good imagers, the pediatric radiologists, you look for other malformations. If God made a little misstep in creating the anorectal area, you want to check the heart, the kidneys, the spine, the other organs, the skeleton.
The most common other thing you would find that would be probably what?
Probably cardiac and urologic, the urinary system, the kidney, the bladder, the urethra. The 10% of the kids will have a blind-ending esophagus. So there's a whole list of things that are all pretty common, and you got to look for them.
So it's a team approach, but if you got down to just that problem only, what would be if you're going to make things better? What could you do down the road?
When the baby was home, growing, thriving, you would schedule a planned operation to reconstruct the anorectum.
How old a kid would have to be?
Oh, I would say somewhere in the first year of life. Somewhere in the first year of life. Not in the first weeks or month, but in the first year of life. It's not written in stone.
Okay, there's all different variations, but
There are different variations. 3 to 6 months.